Hi, everyone. My name is Dr. Shilpa Saxena, and I'm the Chief Medical Officer here at Forum Health. I'm excited to be able to tell you about a new partnership where we have found an amazing genetics test. Now, you've probably heard about people doing genetic tests in the past where you get a list of your genes and quite frankly, you don't know what to do with them. You're not sure if there's certain combinations that are risky or what do those numbers and letters actually really mean. So 3X4 Genetics has a test that really starts to give you a very useful bit of information about your genes. So by taking the genes that they're testing and then putting it through an algorithm, they're able to give you a report that tells you what are the top high-risk combinations of genes that you have and what you can do about it. And when I say what you can do about it, I'm talking about what are the targeted foods you should be eating or not eating? What are the things you should be doing every day with your lifestyle choices that will help you mitigate what your genetic risks are so that you can live a long and healthy life? And even on top of that, because this analysis is so thorough and done by a functional medicine geneticist and dietitian, what we have is results that tell you which supplements will help you mitigate your genetic risks. So come with me so I can show you what that looks like here. So in this window here, you can see that the provider will have access to a dashboard, meaning that they look at your genes and they can start generating reports based on whatever focus you have. Now, the most common focus we have is, hey, will you just tell me the top 3 genetic risks that I have? And for this individual, when it runs it through the algorithm, you'll see that there's these 3 things. Now, I can, as the provider, generate a report. So here we have the report that's generated. You see that it's got a beautiful color story. And what do I mean by that? This fictitious person named Brock Lee, we generated the report, and the color story that I'm mentioning tells you very quickly how much of an impact something has based on the color bar. So you can see it'll go from low to medium to high to very high. And this deep magenta color is your very high risk. So when we look at this gentleman, and we get to his top 3 pathways, because that's what I asked my provider dashboard to generate, we see that Brock, first of all, it'll tell you this is how the algorithm works. And then it says for Brock, what's super important for him to pay attention to is his genetic risk for creating inflammation. It happens to be very high based on this color bar. So it'll define the issue. It'll start telling Brock, hey, focus on these foods, stay away from these pro-inflammatory foods. And then these are the most important lifestyle practices that will help you reduce inflammation. And if you're still having issues with inflammation, why don't you consider these supplements? Now, it doesn't mean you have to take all of them. And that's where our provider comes in to help guide you into which one of these makes best sense with the current supplements you're taking, the medications you're on, or the current issues that you're dealing with. So that was listed as the number 1 issue. And I said there was the top 3. So here's number 2. Said in the same way, you're probably thinking, what's methylation? Well, it's defined here. Again, food, lifestyle, supplements. And then here's our 3rd in our top 3 listed for you. Now, remember that this is very personalized to you, and it tells you your highest risk issues to work on. Next, you will see a directory of all the genes tested in case you want that for reference, telling you what's protective, what might be no impact, and then it goes into low, medium, high, and very high. And in this situation, I might be able to, as a provider, look at these very high impact genes and then understand how that plays a role in some of the things you might be dealing with. Then it goes through and tells us at a big 30,000 foot level, hey, what's going on with your cells? What are the things that can damage your cells that we can work on? What about how it works with all systems in your body that you may be interested in? Things like bone, brain, blood sugar, hormones. And then we call out cardiovascular health because it is the number 1 killer of men and women as adults. And then there's a section on weight loss. Hey, what is going for you or going against you in terms of genes for weight loss and specifically muscle gain? And then there's an activity section that tells you how your genes are designed to help you in terms of activity. So, hey, this person has a very high propensity to injury, but they actually have a very high good impact when it comes to endurance training, not as much with power training. So this person I'd recommend to do more cardiovascular, and some people might have power up at the top. The last section, which is super interesting for so many people, is looking at certain food and nutrients and the genes that are involved. So this person doesn't do a great job with getting enough B12. So this might guide us to make sure that we are using B12 in a supplement regimen. This tells us that the person might have a medium risk for salt sensitivity, for blood pressure, and so on and so forth. And then after that broad 30,000 foot review of everything, you go into a detailed explanation of everything. And this could be like a little bedside book that you read over time, understanding your body, understanding what all these processes are and what you could be doing to improve your mood and behavior, memory and brain health, and so on and so forth. So this report I find to be tremendously useful in terms of really taking your genes and using them and the knowledge about them to push your performance or your health to its maximum level. I hope you'll consider this test. It's super affordable as gene tests go, and then we can couple it with a provider visit, and therefore you will have access to information that not very many people have, but is tremendously useful. And what's beautiful is it's a one-time test because your genes are your genes forever. Take care, and I hope this was useful. Bye-bye. Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.